What are some tips for the PTA licensure exam? What's up guys, my name is Antonio and this is Megan and we both work in physical therapy, and if you're new to this channel, consider subscribing because we talk about things related to the PT career. So if you're looking to be a PT, PTA, if you already are one and you want some tips, some information, that is what this channel is all about. We answer questions here just to help you out, give you a better idea of what to expect. And in this video, we're going to be talking about what do you need to know about the PTA licensure exam? What are some tips to help you out along the way?
So the first thing you need to know is that this test is important because in most states, if you don't pass this test, that you won't be able to treat patients. This is how you get your license. So the first step is making sure you're eligible to sit for the exam. The second step is actually passing the test. And then the third step is knowing that it's not just one and done. You have to actually renew your license every couple of years. So looking at your state requirements to see what the process is, because if you don't do that and your license lapses, you probably have to take the test again.
So how do you study and prepare for this test? There's three things I want to let you know. The first one is there's a Scorebuilders book that you can buy to help you study. I used it and I know multiple other people used it to help them study for this exam, and we'll link it up in the description below. The second thing is we'll post another video on studying tips. We'll link it up to this video because we've already talked about like studying tips, and this video is more geared towards what is the test made up of. And the third way to help you study is by taking practice tests. So on the FSBPT website, they give you tests that are from previous years that you can take to kind of judge yourself of how well you're going to do on the actual test. So basically it's a practice test to help you out before you have to take the actual test.
The test is made up of 200 questions broken up into 4 sections. 50 of those questions though are just test questions, testing the actual question itself. So they're not actually counted towards your score. They're used in future tests if they turn out to be good questions.
Yep. And also this test is a computerized test. So you're going to be with multiple people in a testing center, and it's all computerized, so you don't have to handwrite anything out. It's all online. You have 4 hours to complete this test, and you have a 15-minute break in between there to help space things out a bit too, which is a good thing. Take that break. And also the test is graded from 200 to 800. So 800 is the best you can possibly do, 200 is the worst. But you need a 600 to pass the test. So that's something you need to know.
So the test covers all your body systems, so this would be like musculoskeletal, neuromuscular, cardiovascular system, and then non-systems like patient safety and equipment and modalities.
And a tip to remember is to answer all the questions. So you don't get penalized for a wrong answer, but it does help your chances out if you answer the question. So go through and answer all of them. And also, usually 2 of the questions are kind of out there. They're not going to be a relative answer, but the other 2 are. So hopefully that can at least break it down to a 50-50. And a lot of the questions are composed of things such as what is the best intervention for this? Or what is the best thing you should do in the patient in this scenario? So there are a lot of like best case scenario type of questions. That's just a heads up for when you take it as well.
So one thing to remember is that this is a comprehensive test. So when you're in the program and you're going through it, sometimes it's tempting to just memorize it for that test when you're in the program, but take those opportunities to actually learn the information and practice recalling it along the way. So when you get to the end and you have to take it, it's easier.
So there it is, guys. We just wanted to let you know maybe what the test is composed of, so hopefully it will help you out as you're going to take it. So hit a thumbs up on the video if you found it helpful, and let us know in the comment section if you have any other tips on your studying strategies or anything like that, and let us know maybe when you have to take the test and if you passed it. That's all we have for you today. Peace.